obvious question. What is breast cancer and what are the variations?
So breast cancer is basically when the breast cells start to grow uncontrollably. That's a very basic explanation. But anyway, the cells start to grow and form tumors that will just keep on growing unless we do something about it. There are lots of different types of breast cancer, but the most common one that we see is called invasive ductal carcinoma, or sometimes if it's the ductal carcinoma before it leaves the ducts, that's called ductal carcinoma in situ. The second most common form that we see is invasive lobular carcinoma, but far and away, ductal cancers are the most common. And when you hear people say that they have a cancer or they have a tumor, the vast majority of the time they're talking about a ductal cancer.
And is ductal anything to do with the mammary glands in the breast structure, or is it something else?
That's exactly right. So the ductal refers to the milk ducts in the breast, and the ducts also can form into lobules, and that's the lobular cancer is the cancer that forms in those lobules, but the ductal cancer forms in those ducts. So basically, a simplified version, something that you could, the way I like to explain it and have people think about it in sort of a simplistic terms is that if you have cells inside a duct, inside one of those milk ducts, and they start to get atypical, so they're not normal, but they're not really cancer, and they start to grow, these atypical cells, that's something we call atypical ductal hyperplasia. And if that continues to get worse, if you continue to have more and more of those atypical cells, it can then become ductal carcinoma in situ, which is those cancer cells, but they're confined to the duct in the breast. When those cancer cells break through the membrane in the basement membrane of the duct and go out into the breast tissue, that's what we call invasive ductal carcinoma. There's actually a lot of confusion about that because sometimes people hear that and they think that it automatically means that the cancer has spread. And that's not true. It simply means that the cells are outside of the duct, but it doesn't mean that they've spread beyond that one small localized area.
The next question would be, and I can't pronounce, I never knew how to pronounce this, I'm going to look at it, metastatic breast cancer.
Metastatic. Very close. Very close.
You know, and I used to pride myself on pronunciation. Okay, metastatic breast cancer. How is that different from the others that you've talked about?
Right. So metastatic breast cancer is when the cancer cells have spread beyond the breast.
Metastasizing.
Exactly.
That word I know.
Yep. So when the breast cancer cells leave the area where the tumor formed, most commonly, if it's going to spread, the first place it goes is going to be to the lymph nodes under the arm. That would be called local metastasis, meaning that it's local, local to the area. And then we have something called distant metastasis or distant metastatic disease. And that would be when the cancer cells spread to, for example, liver, lung, bone. Those are some of the brain. Those are some of the more common places that breast cancer would go.
But that's the initial symptom that those who have this, they'll notice a swelling in the armpits. They get their annual exam and a lump is felt. And that's the best time to catch this, obviously.
Well, honestly, the absolute best time to catch this is before there are any symptoms. And that's where screening comes into play. Screening means that we are doing a test to detect something before it becomes clinically significant. And in breast cancer, the primary means for screening for average risk women is mammography. And we recommend for average risk women that they have a mammogram once a year beginning at age 40. There is some confusion, but the majority of the recommendations from the various medical societies, annual screening mammography beginning at age 40 is going to save the most lives. Early detection is key, and that's what screening mammography does. It tries to detect changes of cancer early, so early that neither the patient nor the patient's healthcare provider can detect any symptoms. There's no lump, there's no swelling, there's no skin changes, there's no nipple changes. It simply shows up on the mammogram. And in those cases, it's more likely that we're going to detect that tumor when it's small, when it hasn't spread either to the lymph nodes or even worse, further. And that's definitely the time that we want to get it.
And I'd like to talk to those who have dealt with this, but we do have a phone caller. And Susie, you're on the air now. You also had a diagnosis that led to something. So briefly tell us about that journey.
Hi, yes, I'm just on because I wanted to encourage women under 40 who are young that are listening to do their self-checks, because I didn't, and I don't know if it was laziness or because my family didn't have a history and I was young, but in March of this year, it was an everyday night. I took off my bra, went to bed, and just had an itch, and when I was itching, I felt the lump, and thank goodness I did that, and went in the next day and went for my mammogram and ultrasound and caught it early enough. My next check with my doctor wouldn't have been until May, so I wouldn't have had it checked until then. And I've been on this journey since then. I'm still in it, but I'm getting through it thanks to the help of Baptist Cindy Anderson. And I just want young women to know that you can get through this. Just please do your breast checks every month. It's real important.
Thank you very much, Susie. And that will lead me directly to the three other guests in our studio here. And let's just open it up. And what about the journey of you three? Who wants to go first?
I'm happy to go. I was diagnosed at the end of 2021. I had a routine screening because I'm a high-risk patient. So my mother had been diagnosed with ductal carcinoma in situ when she was 40, and so the general guidance is that you start mammograms 10 years before the diagnosis. And I waited a little bit extra, an extra 4 years, and my first mammogram at 34 was diagnosed with invasive ductal carcinoma. And I had one lymph node that was that had cancer cells in it. Went through, chemo and double mastectomy, radiation, oral chemo, and now I'm on long-term hormone treatments as well as an immunotherapy, Verzenio, which is for high-risk patients like me.
What about you?
I was diagnosed in November of 2015. I actually had a mammogram, and a couple of weeks later, literally, I found a lump, like you could see it. So called my doctor. The mammogram had actually found some concerning tissue on the left breast, which ended up not being it, but they did the diagnostic mammogram and then the biopsy. That was positive, and then they found it in another lymph node from the biopsy there. Went through 6 months of chemotherapy, bilateral mastectomy, 6 weeks of radiation, and then reconstruction. And I just finished Nastrozol for 7 years. So,
Well, here's the young side of the table talking about these and our caller. And now we go to
senior,
but an old buddy of mine, David Luckin, who I work with. And David, yes, guys can get breast cancer.
They sure can. And we don't do mammograms at 40 because we just don't. Men don't go to doctors too often unless it's bleeding or it's breaking off. We kind of stay home and think it'll go away. I was diagnosed December 2020, and I'd felt something a year earlier, and I had a mammogram, and they said nothing there. And I didn't follow up. I could have done a second one. I waited, and then it started to change. And I went to a dermatologist. I said, hey, I know you're a dermatologist. Check this out. And when that doctor looked at that, they said, yeah, you're going to cancer surgery like next week.
Mm-hmm.
So it's been, I guess this is the third year. I'm on tamoxifen. That's a 10-year regimen that I guess it inhibits the estrogen because mine is estrogen-based. I did okay because it was stage 1. I hear horrible stories. I feel very lucky. My heart goes out to everyone who has a much tougher time than I did. I felt like I got through it pretty well.
Well,
I'm
David,
still going through it, but
you
it's
brought
all
up, and this is a question for all three of you, is what was the initial reaction when you told people, and did that concern last, or did they sort of, as David says, did they start ghosting you? Anybody here?
So I was in a unique situation. My husband was actually under care for lung cancer at the same time. He was in remission at the time. So I think it was kind of shocked that we both were fighting cancer at the same time. And my parents were able to come out and help. I had friends come from Pennsylvania, and then another friend from Tennessee actually come those weekends that I was having the chemotherapy. And then other friends stepped up to the plate to help with driving me places and whatnot. But I was also homeschooling my youngest at the same time. So
Talk about a full plate.
Wow. That's what I mean by I'm lucky.
yeah.
Exactly.
And you have a support group because you've been here before to talk about something else with me, correct?
Yes, yeah. So towards the end of my treatment, I joined a dragon boat team for breast cancer survivors, which is how I know Robyn. And it turned out to be one of the best things that I really needed at that point in my treatment. When you sort of get to the end of treatment, people are tired of hearing about you having cancer, and the reaction, instead of like, you got this, girl, is more of like, you're still in treatment, you're still sick, really? So having a group of women and men who know what you're going through, even if that's not what you're talking about, is really, it was really beneficial for me to have that support system. Because people who haven't been through it or don't have a loved one who has gone through it before, they don't always know what to say, and that can make them step away. So you see that a lot, I think, in discussions in support groups, that people's support kind of disappears, not because they don't care, but
Right.
because they just are sort of at a loss for what they can do.
And David?
I joined the online Men Talk Breast Cancer group, and I hadn't even thought about ghosting until I saw other people are going through it. And all I wanted to say was, when you're going through the chemo, it's real tough. You don't look as good as you did. You don't feel as good as you did. It affects everyone around you, but it is so nice and so important when that phone call comes and someone says, I know you're going through a lot of awfulness, but I'm with you. And that's all. Only reason I wanted to bring that up is we know it's hard for everyone involved, but it means so much to hold that phone for a second and know that someone's on the other line.
Well, speaking about the
Who cares?
phone, speaking about the phones,
Take another call.
you guys can join this conversation at 549-2937. Tweet us at FCC On Air. Email us at firstcoastconnect@wjct.org, or look at us on Facebook. Now, Doctor, we've heard how these patients handled it from the doctor's side. What is it? What's the toughest part? And how do you deal with that? Or does it vary? Do some people go, let's rock and roll, let's get this done, and others just disintegrate?
I think the most difficult part by far for me is having to tell patients that they have cancer. Doctors like to give good news. Doctors don't like to give bad news. And it's just really important for us to be honest, but also make sure we provide all of the necessary information so patients know what to expect as much as you can. Know what the plan is. Know what the next steps are. Make sure patients feel empowered so that they know who they can call. They have contact numbers. They know roughly what's going to happen next. And we do provide all of that. I think a couple of things that jumped out at me over the discussions and the amazing stories of the survivors that really stuck out in my head is the importance of not only screening, because that's very important. One other thing that came up was high risk. So knowing your risk, and every person, regardless of your family history, should have a risk assessment by age 30. And if you do have a family history, it's just really important that you talk to your doctor, and so you know your risk and when you should start screening. And unfortunately, screening does not catch all cancers, as you have just heard. And so it's very important that even if you're young, even if you've been told it's nothing, even if the mammogram is negative, if you have a symptom of any kind or a symptom that was stable and is all of a sudden changing, it is so important to go get that checked again or go get it checked for the first time. But let your doctor know. Don't just assume that it's nothing. I will say most of the time it is nothing, especially in young people. The vast majority of the time, if you feel a lump, it's going to be nothing. Nothing, by nothing, I mean nothing to worry about. But you can't make that assumption because sometimes it's not nothing, and we want to make sure we take care of that as quickly as possible. Like I said, early detection is the key to long-term survival, and so that's what we try to do.
What about folks who have no family history, either being a foster child or adopted, and they know nothing other than what you see is what you get?
That's a really difficult situation. I would suggest that you talk to your doctor about whether genetics testing is appropriate for you. It may be in that situation because if you don't know, and you have obviously no way of knowing your family history, what do? You, at the very least, you're going to start screening at age 40. But I would definitely have that conversation with your healthcare provider to make sure that there's not any supplemental tests that you need to do. I would also say that I also don't want people to get lulled into a false sense of security that don't have a family history. 75% of our breast cancer diagnoses occur in patients that have no identifiable risk factors, none. 75%. So if you don't have any risk factors, no family history, it does not mean you're off the hook. But if you do have some of those risk factors, and if you like, I can go over some of those and what we can do about it. But if you do have those risk factors, obviously it's very important to stay on top of it. And we do have supplemental screening protocols that we can do for our higher risk patients.
Well, Peter from the South Side just Facebooked, are women who have had children at risk for getting breast cancer versus a woman who's never had a child?
So whether you've had children or not does impact your risk for breast cancer somewhat, and also whether or not you've breastfed. So breastfeeding reduces your risk, but not every woman can breastfeed. So don't feel like if you couldn't breastfeed that you're doomed. Or it's not like that at all. But there's a lot of different risk factors. Honestly, the biggest ones and the easiest ones to. So first of all, let me just say, actually, there are risk factors that you cannot control, right? You cannot control your family history. You cannot control whether you were assigned male or female at birth. Those things, you can't control your age. Age is another one.
Gee, thanks.
So there are certainly things that you can't control, but there are some big ones that you can. So a lot of people don't realize that alcohol is strongly linked to breast cancer, and there is no safe intake of alcohol for breast cancer risk. Of course, that's everybody has their own choice, but just to at least have that knowledge. The American Institute for Cancer Research also recommends that people try to maintain a normal weight, avoid red meat and processed foods. So there are some lifestyle factors. I don't think we have to say don't smoke anymore. I think everybody kind of knows that, but I guess I'll say it, don't smoke.
Oh, I made a mistake of telling a doctor once that I used to smoke back in my college days, and that darn thing dogged me through every single medical piece of paperwork until I finally put my foot down and said, the last cigar I had was a decade ago. Stop. I'm not a smoker.
Oh, that's funny. But yeah, so I think everybody knows you're not supposed to smoke. But for breast cancer specifically, try to maintain a normal weight, eat lots of fruits and vegetables, whole grains, limit red and processed meat, limit or avoid alcohol. Those are things. And then the things that you can do, exercise. Believe it or not, exercise has been shown to reduce cancer risk in general, but specifically in breast cancer as well.
Well, the question I've got for all three of you is to just go again. After the diagnosis, after the support of friends, how did the diagnosis and treatment affect your dating, your friends, your family? I mean, did you suddenly find that every aunt and uncle from the corners of the world showed up with a cheesecake to help you, or a ride to the doctor, or what?
I had a lot of people who were very willing. I had a very strong church family that people were volunteering to bring meals in, to drive me to appointments, so I never lacked for any of that. I would like to make a comment, about the callers thing. I had 4 children, breastfed all 4 of them, never drank alcohol, was active. And in fact, when I found that lump, I was on my way to a Ragnar race, which is a 200-mile relay race. So with 12 runners running it, but I had been a runner for the past 4 or 5 years. So even with that, you still need to check. But I had a great support system.
And then obviously with the Dragon Boats, you have that core of exercise, friendship, and support.
Yeah, absolutely. When I was diagnosed, I didn't have that support network, so it wasn't really until the end of treatment that I had that. Initially, though, people were really supportive, virtually through Facebook and Instagram and all of that. I remember I posted just an Amazon wish list, thinking, maybe people will send a few things, because there are so many items that you don't think about that you have to purchase as a part of your treatment, like ice packs for your hands and feet to prevent neuropathy from one of the chemo agents that we use, different kinds of pillows and stuff for people recovering from mastectomies. And I had this huge pile of packages 2 days after I posted that wish list outside my front door. And I had a great response to my GoFundMe that I had posted. And it was, I wouldn't have survived without those kinds of things. It does seem like as time goes on, people, maybe they've already given, or, they're sort of skeptical about whether or not you still need help. So it does seem to maybe dissipate a little bit, which is where having that good support group of survivors with Limitless has really helped me. But one of the biggest pieces of advice that I got in the very beginning was you absolutely have to get comfortable with asking for help and receiving help when it is offered or given. And so I really tried to embrace that. And, whether or not it persists throughout the entirety of your treatment, that'll depend on the person and their network. But it's hard for everybody to ask for and receive help. So,
Well, David was very quiet about it on Facebook. I know. I heard it through friends, and we hadn't actually connected in a lot of years. So, David, what about you? A guy with breast cancer, that probably immediately disbelief among friends.
Right. Two things. First, for what you're talking about, my wife retired the month before I started chemo, so I got all the help I needed, the best help I could ever had, with the rides, with the comfort, with the cream of wheat for breakfast, whatever it takes to get through the day. That said, Dan, let me say one other thing first before I answer you, and that is for men out there, there's no shame in getting breast cancer. And I'm just reading online, a whole lot of people don't want to admit they have it because it's a women's disease. Okay, pick your cancer. Would you rather have, pick a different one? Like you just said, you did all the right things. There's people who got lung cancer who never smoked, so there's no shame in any of this. It's unfortunate, and you just put your best foot forward, and you get a good support system, and we carry on the best we can.
Well, Doctor, I got to ask this question. We have from one listener, Lauren from Facebook. What is the link between breast and prostate cancer? Now, David was talking about, would you rather have another kind of cancer? I'm a guy. To me, that's the biggest cancer concern of mine, which is why I have been tested. But is there a link, or is that far down the line when things metastasize?
I guess if you're asking, does breast cancer go to the prostate, to my knowledge, it does not, and vice versa. There are some similarities. There's similarities among risk factors. There's similarities among the fact that they are hormonally active tumors. Obviously, biologic men can get prostate cancer. Both men and women can get breast cancer. But there are definitely molecular links that are there are similarities, I should say. It's a little bit beyond the scope of my expertise, but yes, and a lot of the same risk factors for breast cancer are also risk factors for prostate cancer.
Okay, something to consider, guys. We've already had discussion about GoFundMes and helping, but financial burdens are frequently placed on patients receiving treatment as they progress towards recovery because they may not be able to work. They may not be able to work as fully. What needs to change to help people? Insurance only goes so far, obviously.
Having an understanding employer like I had here made it a lot easier to work from home when I couldn't come into the building. So there's adjustments one makes, and hopefully we have understanding employers to help us in that realm.
I was actually a stay-at-home mom at the time, so that wasn't a big issue. But for my husband and his cancer, that was definitely having an employer that was understanding when, he wasn't feeling well or whatever. So.
And that's a double shot. That's both spouses, both supporters, either emotionally, physically, or financially affected. Did you ever say, "Hun, we got to sell the boat, the car, the house. We got to get an apartment.
Yeah.
We got to go live at mom's"?
When the cancer came back and he was in hospice, and I wasn't sure how he'd be able to keep on because the leave was going to be cut in half. And so I thought, well, I'm going to sell his truck. He's not going to be able to drive it anymore. But then he got it in his head. He wanted to buy me a horse. And he said, but I don't know how we're going to get it around. I don't have my truck anymore. But,
Oh, sure. Then you'd have a broken leg to deal with from falling off the horse.
Funny you say that. I actually did break my leg.
Oy, Gewalt. My.
3 months after my husband passed on my birthday on vacation.
There's the song, "If It Weren't for Bad Luck."
Yeah.
But here you are, smiling, alive, and with a mended leg kicking.
Yes, I took on the motto as I started my treatment, "I can do hard things." Since then, I have climbed Machu Picchu. I did Kilimanjaro this summer. Did not quite reach the summit, but got up to about 18,000 feet. But learned a whole lot about myself, and I kind of just take the advice that, you can laugh or you can cry. Crying gives me a headache, so I'll laugh my way.
I'll just say this personally. When I had my heart surgery, my goal was 8 weeks later, I was going to be in Greece for my best friend's wedding. And where we were going to have the wedding, there's a volcano. And I said, I'm going to climb that volcano. And I did. Stupid me fell twice on vacation. Of course, with that kind of surgery, they have to stitch your breastplate together. So I ended up face planting into some poor guy's backpack to avoid getting hit in the chest. But yeah, I had that goal. And so I do appreciate that as a goal. What about you? You said you didn't have the dragon boat until later. So how did you keep the spirit and the finances together?
I was very active before my diagnosis, and I sort of kept that up as I progressed through treatment. Especially in those early days when you're not sure what your treatment is going to be or what you can even do, it felt really empowering to be able to at least exercise and feel strong. And I think that helped me a lot through treatment. So I worked out essentially every day, even on the days that I received chemo. And it just felt like a little something that I could do to help myself. And I had this goal in mind. I had never been a runner, but I had started running literally just a month before I was diagnosed. And I had never run a 5K before, so I thought, I'm going to run the Mother's Day Donna 5K. And I did that while I was in treatment. I was bald, and it gave me something to look forward to. It gave me a goal that was achievable. And now I'm training for the full marathon. So it was a way for me to take charge of my health and support myself and have, sort of these mileposts, because otherwise, going through treatment, you don't know how long it's going to be. And so having, these set points where you can say you achieve something is really important.
But does anything need to change in this world so that what you three went through, and Doctor, you can certainly chime in on this, went through can be easier from just a financial or just an emotional standpoint, other than the support of friends? Does something need to change with an employer or whatever?
Well, I will say that there are enormous healthcare disparities. I don't think that's a surprise to anyone. I think if you have health insurance, that is most of the battle. Unfortunately, a lot of people don't have health insurance or have super high deductibles. I will say, though, if you have a breast symptom or if you need a screening mammogram, go to a breast center. Most of them, if not all of them, will have resources available to help with some of the financial aspects. It's so important. I think it's even harder if you don't have the health insurance and you don't have some of those resources, but you really do have to be an health advocate for yourself. Those resources are available, but sometimes they're a little tricky to find.
And anybody who's had to go through a laptop trying to figure out certain government documents, I'm sure, agrees. Any thoughts from our
I would just say it's really important to have good faith in your doctor. I've talked to people who changed doctors or have had the same doctor from day one, and it's really important that you trust your doctor trusts you, and you take their advice.
you guys?
I guess to return to the financial aspect, it is a substantial burden, even with really great health insurance. I do have wonderful health insurance, but until you reach that out-of-pocket maximum, you're still paying a good amount, and even things like routine maintenance treatment after you're finished with what is considered active treatment are extremely expensive. So I was taking getting Lupron injections, which is a hormone blocker to shut down your ovaries, and that was in the neighborhood of $400 to $500 a month until you reach your out-of-pocket maximum, and that was, a 5 to 10 year deal. So I decided to have my ovaries removed, which lessens that burden. But every year you sort of start over,
And that was
and
still
it's like-
another expense, obviously, there. Yes.
Right.
Preventative it may be.
Right, exactly. I mean, once you reach that out-of-pocket maximum, then you're kind of golden. But you're still dealing with copays and things like that. And if you're having to go to the doctor 3 or 4 times a week, paying a copay each time, it is a burden. And there are lots of costs that are not covered by insurance, like over-the-counter drugs, things like those ice packs that I mentioned. It's a lot.
I will tell you my favorite or less favorite phrase coming when my surgeon walked in and said, "Well, you've just had the $1 million surgery." He wasn't too far off. It was $900 and something thousand. Insurance paid all but $3,000 of it. You want to know how good my wife and I felt at that point, that something worked? So I do understand. And then the follow-ups, and I'm still about ready for some follow-ups. I've been, in fact, heavily advised to do some follow-ups. So, doctor, we have young folks here, old folks here. How common is it for a woman to get breast cancer or diagnosed with it under the age of 40?
The most commonly diagnosed age bracket is going to be over 40. However, I will say that every single week I see somebody under the age of 40 that has breast cancer. So it certainly does happen. And that's why it's so important that if you feel a lump, if you have focal pain, if you have any nipple discharge or nipple changes, skin changes, armpit swelling, anything that worries you at all, just get it checked. It's so much better to get it checked and have it turn out to be nothing than to not have it checked and have it turn out to be a cancer that's just sitting there. I wish I could say I never saw cancers under the age of 40. Unfortunately, I do. I will say it's very rare under the age of 30, although I have seen it. And we don't want to alarm a lot of people under the age of 40, but it's very important that, A, you know your risk. Your doctor can do a risk assessment, or if you come to a breast center, any of the breast centers in town, for example, if you come to Memorial Health Breast Center, Baptist Breast, any of the breast centers, they should be able to do a risk assessment for you, or even in your doctor's office. So if you know your risk, you may need to start screening earlier. It's just really important that if you have any symptoms that you go ahead and get those checked.
And we want to thank all of you. Remember, October Breast Cancer Awareness Month, and we've had people here who know what they're talking about.